Okay. Hey all, welcome. Happy Wednesday. My name is Annie Pocklington and I am here with Washington State Gear Up for another one of our vocational and technical program overviews. We're really excited to have Spokane Community College here to talk about their dental assistant certificate and a few other dental opportunities. So I'm excited to have them. A few quick housekeeping things before we dive in. First and foremost, keep your camera off and yourself muted for throughout the presentation. There will be time for question and answer at the end, so no worries there. If something comes up and you don't want to forget it, go ahead and write your question into the chat, and we are happy to ask those questions to our guest at the end of the presentation. For attendance purposes, we need you to rename yourself in Zoom, please. So use your first name, your last name, and the name of your high school, and we'll be able to see who's in the room with us today. If you don't know how to do that, no worries. You can also drop that information into the chat and I will be able to connect with your Gear Up coordinator and let them know that you are here today. Alrighty, so when we talk about college at Gear Up, we are really talking about a variety of pathways. So we're talking about things that you do after high school to help you get to a specific spot in your career, to pursue or further your education. So we're talking about 2- and 4-year opportunities, vocational and technical programs or certificates, as well as things like military or career pathways. The lucky thing for us in Washington State is that we have so many institutions and they're all really incredible. But what makes a post-secondary journey the most incredible experience is when you're thinking about yourself first and foremost as you figure out where you want to go. So you want to make sure that when you're choosing a post-secondary pathway, you're really considering your own personal wants and needs so that you're comfortable and able to succeed in that pathway. So you'll want to think about, again, what kind of career do you want? Where do you see yourself down the line? Does the campus, institution, or certificate program have a major or a career focus that lines up with that? What kind of social experience do you want? Are there housing and work opportunities around that institution or available to you? And then, of course, you always want to think about what the cost of that program or college pathway is. So the fun thing about the series that we're doing right now, this is our technical and vocational program series, is that it talks about those things, right? Technical and vocational programs. So if you are a student with a very specific career interest and you're looking to get into the workforce relatively quickly, this may be a really nice series for you to kind of assess what different options are out there. So the cool thing about technical and vocational programs is that they vary in career focus, in the length of the program, the cost of the program, but they have one thing in common, and that's really that they want to give you hands-on training for a very specific career. So you can see a few of the opportunities listed here, but this is a really abbreviated list. So there's healthcare opportunities. Obviously, we have Spokane Community College here to talk about the dental assistant program, computer and technology, culinary arts. We had Fire Academy present last week, so a whole lot of different opportunities. The type of degree or certificate you get from these programs also varies, so just something to keep in mind. As with any post-secondary pathway, you definitely want to reach out to the program, ask a lot of questions, and make sure it's the right fit for you. So if you weren't around for our virtual visit, our virtual campus visit this fall, we did that through Washington State Gear Up and looked at 16 different campuses across the state of Washington. So if you're interested in exploring that series and the other series that we have on our Gear Up website, you can go ahead and visit that first link there. We also like to mention that WACAN has a really awesome resource, and it's essentially a big map of Washington State with all of the institutions across it. So it includes 2-year and 4-year opportunities, as well as vocational and technical. Yeah, a great map to check out and a resource that you want on your list of resources. So you can absolutely reach out to me for that or your Gear Up coordinator, and we'll make sure you have all the things you need. So with that being said, a little bit about Spokane Community College before I pass it off to Pat. First and foremost, it's in none other than Spokane, Washington. I know the name kind of leads us on to that, right? So you can see Spokane is represented by that white star on the state of Washington. And the cool thing about this certificate program is that it's housed at a public community college. So Pat is going to tell us a lot more about that, but just a quick look at the institution and program before we dive in. So without further ado, I will pass it off to you, Pat.
All right. Okay, can everybody see my PowerPoint? Hope you can see that. Perfect.
Yes.
Okay, so my name's Pat Norman. I am the program director for the dental assisting program in Spokane, and it is a 9-month program. Before I get into dental assisting, though, I can attest to Allied Health and Healthcare in the state of Washington is one of the leading employers. So this is a good pathway to go if you're looking at wanting to help people and to have a really good career. At Spokane Community College, we have several programs, not just dental assisting. We have medical assisting, pharmacy tech assistant, surgical tech, invasive cardiovascular, ultrasound, nursing. We've got a radiology tech. So we've got a lot of different programs that are really, really good to look at. All of our programs are accredited through our national organizations. And that means that the National Accreditation Society, whoever that is, for us, it's the American Dental Association, visits us every 6 to 7 years and reviews all of our content as far as what we teach in lecture and labs and clinicals. We've got great support with all of these, and this keeps us so that we can keep our numbers at a really manageable number. For instance, in lecture, I can have 36 students, but when it comes to lab, one instructor to maybe 6 or one instructor to 9, so that you get a more personalized type of experience. So with that, let's go into dental assisting. Dental assisting at Spokane Community College has been around for a very long time. We're in the 50 to 55 years at the community college. There is a huge need of dentistry and dental auxiliaries right now. So I'll talk specifically about dental assisting first. Then I can talk about what are some of the new legislation that's coming out and some of the career paths that you can take. And then I can talk a little bit about dental hygiene and then dentistry itself. So depending on where you fall on that paradigm, we can talk a little bit. So dental assisting is really a 1-year course of study. And I would even say more of a 9-month. Most programs, and for us, we start in September and then they graduate in June. There's a didactic, which means lecture. There's a laboratory portion, and then clinical skills. So some examples of didactic are lectures that are in general chairside, or learning how to sterilize correctly, taking x-rays, taking impressions. So if any of you have ever had orthodontic treatment, some of those different kinds of skills. Once you pass the didactic or the lecture in the laboratory section, then you get to go to clinical sites. And we set you up at these different clinical sites and you get experience actually working in the dental assisting field with dentists and different specialties and dental assistants. And so basically we're programmed and accredited through the American Dental Dental Association. Okay, so for us, there are no prerequisites. I don't know about other programs across the state, but there's no prerequisites for us. You do have to graduate from high school or have a GED. So it is not a running start eligible program. There are 67 credits that are divided between 3 quarters. So it's a pretty heavy, fast paced program. We have 2 5-credit classes from liberal arts. Now, you could take those prior to coming into the program, or you could take them while you're in the program. And one is English 101, and the second is interpersonal communication. So if you're looking at that, English 101 is the code name for what you would be registering for. Interpersonal communication, if you ever see something that says CMST 210, that's an interpersonal communication, and those are required by the American Dental Association. So you can take this and make it a 2-year program and get an Associates of Science. You could do 9 months of dental assisting and then do 9 months of other liberal arts classes, or vice versa. You could take liberal arts classes and then come into dental assisting, but it's not required to get your certificate. The requirement for your certificate is the 9 months of dental assisting. So here's a sample schedule of what we look at. So this is coming up fall of 2021. So you can see in Mondays, here's the first schedule. So where it says 8:30 to 10:30, Dent 111, that's chair side. So that's a lecture. And then you see 10:30 to 12, we do some anatomy. And then we have a break, and then we come back and do dental materials. If you look at Tuesday and Wednesday, they're exactly the same. So these are our lab days. So these are days where you would be in one of those classes, a Tuesday or a Wednesday class, and you would have lab instructors, and you would take what you learned on Monday and then apply that in lab on Tuesday or Wednesday. You can see Thursday, then everybody comes back for a lecture, and we talk about radiology, we talk about infection control, and some more anatomy. So for us, generally, especially with COVID right now, everything has been on ground, but Mondays and Thursdays are lecture days, Tuesdays and Wednesdays are lab days, and then Fridays we do online assignments, online testing, things like that. So you're going to want to have some computer skills and some savviness there. So some of the topics that we cover, you can see the tongue here, that's called black hairy tongue. That might be more of autoimmune disease. It could be antibiotic use. So we talk about pathology. We talk about some of the different things that you'll see in patients' mouth. The second picture where you see the ABC, these are different radiographs or x-rays that we take at the office. And we have, for our lab, we have 6 radiology units where 6 people could take x-rays at a time. And we have 12 chairs where people can work. And then you can even see a lot of dentistry is focusing on aesthetics anymore. So even the bleaching or veneers or crown and bridge, some of those kinds of things. So that's just a few of the topics. So what we do is we take 36 students each year, and all of them have lecture or as many as we get into the program. And then in lab classes, like I stated before, we have smaller groups. So our ratios, for example, radiology is a 1:5 or a 1:6. Whereas if I'm teaching you how to sterilize, I can do a 1:9 or a 1:12. Or so it just depends on what the topic is in lab that you're being taught. So that's why we have all of our lectures is everybody together, and then our labs are small group. One of the things I should say is that for us, we have gone from what's called a wait list, where you just apply to the school and you get on a wait list, to an interview process. And so as we go through this, I can explain what that looks like, because it's more similar to what like a hygiene school or a dental school looks like. So interview process. So here is my email and my phone number. And what I do is do things like this, where I do some presentations, or when people contact me, I ask that they contact me and we talk one-on-one, even if it's over the phone. And I'm asking for an admission packet by June 15th. At June 15th, I take all of those packets and then I invite those applicants to come in July to do an interview, where they're going to meet our advisory board, meet other instructors, do an orientation, help with registration, and those kinds of things, so that you can see what you're getting into and making sure it's really the right fit for you. So you'll be notified right after the July 15th of the interview time in July. We bring you in, and then what we do is, in this packet that you need to have for us by June 15th, I need a copy of your high school diploma or a copy of your GED. Now, I understand that many of you are still in high school, and this is a couple of years down the road. And June 15th is a date before you would actually get your diploma in hand. So what you would do is, when you submit your packet, you would say, I will be a recent graduate of this high school, and my diploma will follow. So you can add that to your file later. What I really need from you, though, then is a professional cover letter, a resume, and then any documentation of observation hours that you've done in an office. So we like you to go to a general office and observe either a morning or an afternoon, so approximately 4 hours, so that you can really see what happens in a dental office and what the roles of each person plays, and is this really what you want to do? So that can be, even many people ask me, where do I get this? I would contact my dentist that I already go to, or if you have family or friends that have some connections, I would call those offices and request to have some observation time. The last thing I need is 3 letters of recommendation. So that could be recommendations from employers, from school, counselors, teachers, anything like that. Maybe you're involved in a church group, or you do volunteering through one of the many areas through the state. So it could be from anybody. So number 1, high school diploma, professional cover letter, resume, and then showing that you have documented your 4 hours of observation and 3 letters of recommendation. Those get sent to me, and you can send them via email, or you can mail them or drop them off at the school. So any of those things can happen by June 15th. Now, here's what's going to change. And actually, this just changed this morning. It says appropriate college entrance scores are required. Spokane Community College at one point would have you take a placement test to see where you were at in English. So you need to be able to self-assess and find out, can I take an English 101 class and be successful? There is no official test anymore. Math placement at a level 21 or above, for many years, what we had to do was go to the Math Placement Center, take a math test, and find out where you fell. Math 21 is going to be a thing of the past, and so the math placement will be gone. For those of you who are like me, math is hard. That's not a bad thing. So we have several full-time and part-time faculty. We basically have 4 program faculty. We have 2 full-time faculty and then 2 adjuncts or part-time. And then we have numerous speakers or dentists that come in throughout the year. So we have general dentists come in and work with us. We work with orthodontist and endodontist. So orthodontist, if you are not familiar with dentistry, that's more of aesthetic, but also straightening teeth so people can have proper function or chewing. An endodontist is a dentist who has gone additional training and has specialized in doing root canals. Oral maxillofacial surgeon, maybe you have met them before. They're the ones who are doing wisdom teeth, but oftentimes they're also people who work in the hospitals because of trauma. A periodontist takes care of, so it's again a dentist that has gone to dental school, but then gone to additional training to take care of diseases of the gums or the tissues. Pediatric, obviously, children. And then we have lots of different opportunities with insurance companies and sales reps and all these different kinds of places that will come in and speak. And so the dentists are really, really kind to us. They come in on their own time, they're not paid, and they will do maybe a 1 to 2 hour presentation to see if you are interested in working into some type of specialty with your dental assisting. Okay, so here's the textbook that we use. It's a dental assisting. It's called a comprehensive approach. The fun thing is that the program director just previously to me and the other full-time person wrote this book. And so this is pretty comprehensive. This is what we're using, and we use a workbook. When you enter a program like mine, what I'm looking at is trying to keep the expense down as much as I can. So this book and the workbook that accompanies this are 2 of the 3 books that you will need all year. So you will need 3 different books, and this is one of them, so that you don't have to buy new books every quarter. So fall quarter, you buy these books. We will utilize them during winter and spring quarter. We also are involved in the community as much as we can. This year's been a little bit harder to do that because of availability of us getting into different places, but we have what's called an Explorers Club. And in this club, what we're doing is we are partnering with, for us, Eastern Washington University dental hygiene students. And we are going out into the community. We're entering preschools and kindergartens and teaching children how to brush and floss and how to keep their oral health up. We also have lots of different on-campus activities that we're involved in. So here's a couple of pictures of our dental lab and some of the students working. So here is part of a dental lab that is more for laboratory work, such as taking impressions or pouring up plaster and stone models or trimming. And so you can see different students doing that right here on the countertop. The other lab that we have is the clinic. So we differentiate between lab and clinic. So over here in the clinic, you can see our instructor in the white coat. I don't know if my arrow will show, but over here, right under the word dental clinic, we have 12 different chairs. So we have 6 chairs on one side of the bay and we have 6 chairs on the other. And what they're learning here is how to put a rubber dam on. That's that little piece of rubber that goes over your face so that you can keep the area dry for the different materials that we use. So we have an instructor in the white coat just jumping from chair to chair, helping each student with learning their skills and their techniques. So this is just, our clinic has been remodeled. I think it's been about 10 years now, and it's just beautiful. So here's myself and Dr. And another of the faculty that we work with. We also have a reception area so that we can mimic what a dentist office or a clinic might look like. Our dental reception room is pretty small, but we've got seating for probably 12 people. Then we've got a front desk. So you also learn a lot of practice management skills. So you're also learning how to set up charts and work with insurance and to answer phones and all of those different kinds of things wherever they may need you in a dental office. We also have the radiology areas. So this is a student right under the words radiology areas. So she is taking x-rays on a mannequin. So we have these mannequins and you can see the tube head that is going to be aiming the radiation. But that's where we take different types of x-rays. So we learn how to take x-rays that are inside of the mouth. We learn how to take x-rays outside of the mouth, like a Panorex or something that an orthodontist or an oral surgeon might use. We still teach traditional film and automatic processors, but we are definitely moving forward into more of the digital age. And so traditional film, we teach for about a week or two, and then we go straight to digital. And so you can see there's different screens and different really quick ways of taking x-rays. So what is the salary? Oh, it's not 176. Boy, wouldn't that be great? The Spokane area for us is between $17 and $20 an hour. The other compensation that people will be able to make is maybe medical or dental insurance, uniforms, continuing education. Oftentimes there might be a vacation or some type of incentive for once we hit our production and we go on a continuing education trip together. It could be tuition reimbursement. So there's several different ways of also getting a higher wage. So the $17 to $20 that's the dollar amount. The rest is in addition to. On the other side of the state in Seattle, obviously because of cost of living, it's going to be much higher. And even 17 to 20 in the Spokane area might be a little low right now because there's such a need for dental people, for auxiliaries to work. And the cost of living is going up, but also our minimum wage is pretty high in our state. So we are the only accredited program in the area. The dental offices are very supportive of our program. There are other private schools, but the cost of tuition is going to be so much higher. And then there's different dental office training programs. If you're looking at tuition for community college like Spokane Community College, by the time you pay tuition and lab fees, it's probably about $5,000 overall for the entire year. Private schools can be anywhere from $10,000 to $15,000. Training programs are going to be very expensive as well. The other beauty is if you're applying for any type of financial aid with FAFSA or anything like that, then you can use that through a community college. I've alluded to this before, but we work really closely with Eastern Washington University Dental Hygiene School. Our other full-time faculty is actually a dental hygienist, and she graduated from there. And so we've got a really good partnership with school. And so independently, we do lots and lots of presentations and lots of community service as much as we can together. So what's the future? The outlook for the Department of Health and the Department of Labor, it's huge. This is through 2024. I think this is going to still continue throughout till 2028. There is a huge shortage right now of dental assistants, of what we call FDAs, hygienist, all of those different kinds of things, and even probably a shortage of dentists because of the liability and all of that they take on. So the future of our program, we're going to be facing a large shortage of dentists. But the good news is that for many years, we didn't have access to care for the outlying areas in Washington State. And so Department of Health came in, and if you look at the bottom, it says dental assistants will expand their scope of practice to meet the needs of patients. This is happening before our eyes. We have what's called an EFTA program, or an expanded function dental auxiliary. So you can go to school to be a dental assistant for 9 months, then go to school for an additional 6 to 9 months, and you can learn how to place fillings or take final impressions. There also is, if you're really interested in surgery, an anesthesiology assistant, and that allows you as an assistant to be able to do IV sedation and not actually give the medication, but place the IVs and to pull up medications and different things like that, which then of course your wages are going to go way up. So in Spokane, if you become an expanded function dental auxiliary, you're probably looking at right out of school $25 or $26 an hour. So to kind of give a little history of this, so if I was talking about being a dental hygienist, in our state, a hygienist can do 3 things. I don't know where my camera is. 3 things. They can clean teeth, they can give anesthetic, and they can place fillings. So what the state did is they said, we really have a shortage and we really have a need for dental assistants to do more things. So they said, what are one of the things they could do if they were, a hygienist? So a hygienist is still the only one that can do the cleaning of the teeth and give anesthetic besides the dentist. But what they're doing now is they're allowing assistants to go to school a little bit longer. And so it's basically a third of a dental hygiene program. And that allows us to place fillings. Really exciting times, tons of new technology, tons of change, but that's also the probably the history of what is happening in all healthcare. We're a great place to get a career and earn a living that keeps on giving. So if there's any questions.
Awesome. Thank you, Pat, so much for the information. We do have a smaller group today, so if you have a question, you can drop it in the chat and I am happy to read that off, but also feel free to unmute yourself and ask.
I've noticed, Annie, this is Stephanie from Federal Way. The chat is disabled at the moment.
Funky. Okay, well, my apologies for that. So go ahead and just unmute and ask your question if you have one.
I have one. So how long does the I don't really know how to pronounce it, anesthesiology assistant?
That's a great question. Yeah.
How long do they go for school?
Okay, so that one, the Department of Health, I actually was able to work with the Department of Health on that legislation. What you would do is go through a dental assisting program. You would become a dental assistant in an oral surgery office, and then the oral surgeon would be your instructor. So you wouldn't come back on campus. You would be doing the same program or the same education that the dentist or the oral surgeon does. And so they sponsor you and you go through the education that way. So it saves you on the tuition and things like that. And the dentist actually checks all of your skills and verifies that they're good. And it's a self-paced. So it could take 6 months, it could take a year. But it's just another option that you can do, but you would be directly under the supervision. You would take an exam at the end. It's called the dance, which always makes me think of Garth Brooks or something crazy, but it really is called the dance. The dance is the test, and you take the exact same test that they took as an oral surgeon for that piece of it. Does that help?
So to clarify, it's just 9 months in school.
Right.
Oh, okay.
Yeah, and then anesthesiology, your oral surgeon that you go to work for would then sponsor you and be your instructor after that.
And then, do you know how much they make a year or like their salary pay?
So you're in Federal Way area?
No, I'm in Squalicum.
Okay, so you're on the other side of the mountains. The other side of the mountains is always going to make a little bit more than Spokane. Spokane, our students are just getting ready. They're finishing up. So what we do is we have lecture and lab, and then they go to these different clinicals. And we have 3 different clinicals that they go to. So they go to 3 different offices. And that's usually where people get hired. They don't really even have to go through an interview process. It's almost of a on the job kind of they're already doing on the job training kinds of things with these offices, and then they hire them right up because there's such a shortage. But I would say even like our students, I think the lowest somebody's taken so far is $1,750. The highest has been 20 or 21 with other benefits. So on the other side of the state for dental assisting, I'm thinking you're going to be in the 20 to 22 starting. I don't know the wages really well over there.
Okay,
Great
thank you.
questions. Great questions. Any other questions for Pat?
I have one. My name is Makara, and I was wondering, what is the difference between a dental hygienist program and a dental assistant program?
Great question. So dental assisting programs generally are 9 months in length. A hygienist is going to be about 3 years. So you're looking at a little bit more education, and you're going more in depth with anatomy and physiology and some of those kinds of things. Now, I can speak to SCC where I work and EWU, which is the hygiene school here in Spokane. It's very competitive right now to get into a hygiene program. So you're going to want to keep your GPA as high as possible. You're going to want to do some of those observation types of things. If I was looking at a hygiene school, I would contact that school, find out what their requirements are, talk to their advisor, because they all have an advisor. So I have 5 children, and 3 of them are in dentistry. I have one who's a dental assistant, one who's an FDA, and one who's a hygienist. And so my hygienist daughter did all of her prereqs at the community college so that we could save a little bit of money. And then she went to hygiene school. When she first applied to hygiene school, she only applied to our local university here in Spokane. And they, again, are interview process. And so they took, let's say they took 30. She was number 31, so she didn't get in. So she was pretty bummed because she had not wanted to apply anywhere else. And then she realized I need to apply to as many schools as I can. And then if my worst case scenario is I just have to choose which one I get once I get accepted. And so that's what she did the next year. And she got into Yakima Valley and she loved it there. So she ended up going there. She ended up getting into Eastern after she was accepted to Yakima Valley, but she had already moved. So we were like, you're just staying. But it's a 3-year program. The cost is you're going to need to get some student loans. You're probably looking at $60,000 to $70,000 as far as that goes, or working with FAFSA or scholarships or whatever those types of things are that are available to you. So in Spokane or in Washington, a hygienist, like I said, can clean teeth, can give anesthetic, and can place fillings. A dental assistant can't do any of those things. If a dental assistant wants to go on for the extra 6 to 9 months, then they can become an FDA and then place fillings, which is a third of the hygiene program.
I have another question. So is there any like dentistry like schools on the other side of the mountain? Like
not in the Spokane area. Okay, so and that's kind of a harder question, not super hard, but University of Washington is the dental school here in the United States. For us, for Washington, University of Washington has a special program called the RIDE program. And so what they do is one of those years that they are in school, so they're 4 years of dental school, they can apply to come over into the Spokane area, and they work in the same building at Eastern, at EWU, with the dental hygiene students. So they are over here on this side. And part of that was Washington State was trying to lure more dentists into the different rural areas or into the areas that we needed more dentists to come to. So I guess maybe what you probably should understand. So a hygienist needs to get their AA degree or their direct transfer degree.
Wait, that wasn't my question. Sorry, I'm misunderstanding. So my question about I still don't know how to pronounce it, the anesthesiology.
Anesthesiology.
Yeah, the assistant. So is there schools like near the Northwest
Oh,
for
like on the other side of the mountains from Spokane?
Yes.
Yeah. Yeah. So what you would do is you would go to whatever school is accredited by the American Dental Association, and there's several schools across the state. So you could even get on the American Dental Association and put down Washington State Dental Assisting Schools. So then you could look at those schools, go through the dental assisting program, get hired on with a oral surgeon, and then continue on from there.
That's a great resource. And I also want to mention Google is sometimes your best friend when you're looking for specific programs. So try to put as much information in that, like anesthesiologist assistant programs in Washington or in Western Washington. Another great resource for any kind of college program or post-secondary pathway is a website called Big Future. So if you go to bigfuture.com, there's a college search tool on there. And if you just select your location and what kind of degree or focus area you're looking for, they'll generate a list of options for you. So a few more resources around that. While I have the mic too, I just want to speak a bit to financial aid. Programs do definitely cost different amounts, but filling out a financial aid application is a great way to make sure that you are covering your bases and having that kind of financial support. I would also highly recommend reaching out to your Gear Up coordinator or your graduation specialist or someone in your high school if you're concerned about the financial cost of college, because yes, they are high, but there are ways around those, whether it's a $2,000 program or a $70,000 program. So just something to keep in mind. Don't shut any doors until you've explored all your options.
Well, I think find out what your passion is too, because if it's a program that costs $70,000, you can make it happen. There's lots of ways to apply for those scholarships and financial aid. You don't want to cut yourself short.
Absolutely. Absolutely. Well, any other questions while we still have Pat here with us?
Could you explain the like schooling you'd have to go through to get into orthodontia?
Like an orthodontist or like an orthodontic assistant? Okay, so that's where I was kind of going before. So to be a dentist, you have to get your AA degree and then move to a 4-year institution and finish with your bachelor's degree. We call that undergrad. So you have to either get 2 years at a community college, then go to a university, finish up for 4 years, or you can even start straight at a university and you would get your undergrad or your bachelor's degree. Then you would apply to dental school, and you would apply to several dental schools, and you would want to see what you can get into. You would go 4 years to dental school, and then you would do an additional 2 years of specializing in orthodontics before you could actually practice. So you're really looking at about 10 years of schooling.
Okay, thank you.
Mm-hmm.
Good question. Anybody else? All right. Well, Pat, thank you so much for being here with us today. We had so many questions, which is always a sign of a great presentation and a lot of student interest. So we just appreciate your time here today. Again, students who are on the call, I really encourage you to reach out to Pat or me if you have any follow-up questions. And same goes with your Gear Up coordinator, right? If you have any questions about pursuing a post-secondary pathway, financial aid, scholarships, anything like that, we are all in your corner and rooting for you to make the best decision for you. So reach out if you have more questions, and otherwise we will see you all next time.
Thank you.
See you later. Thanks so much, Pat.